Tonight, an important Eyewitness News alert, unexplained miscarriages.
We've learned the health department is digging deeper to get some answers. It's a mystery for many women. What caused them to miscarry?
Right now, we've discovered the health department is looking to see if food-borne illness is playing a deadlier role than anyone ever thought. Only in Eyewitness News tonight, Susan Hogan reveals this new investigation.
Eyewitness News has learned the health department, along with the CDC, is conducting research right now. They want to know about patients' knowledge of listeria, a serious infection caused by eating contaminated food, which for an unborn baby could be fatal. It's a tragic loss.
I was in disbelief because that stuff doesn't happen to me.
In June of 2009, Nancy Krause had a miscarriage.
Just sometimes it happens.
That was the explanation you
That was the explanation I got.
But for this WPRI employee, that wasn't good enough. Nancy wanted to know why her pregnancy suddenly ended at 9 weeks. She thinks she knows.
I absolutely think that I had food poisoning.
Nancy says at 7 weeks pregnant, she ate at a Mexican restaurant, and shortly after, she says she became violently sick, fever, diarrhea, vomiting. Then 2 weeks later, at her 9-week ultrasound, Nancy learned her unborn baby had died.
Obviously, if there's something preventable, we want to make sure we find the cause.
Eyewitness News has learned that doctors are not required to test for listeria or other food-borne illnesses if a patient miscarries, even though, according to the CDC, pregnant women are 20 times more likely than healthy adults to get listeriosis.
Well, there's a high death rate associated with listeria. So we want to make sure that if there are cases occurring, we learn of them.
So this study will tell health officials two things. One, are pregnant women getting the information they need about the dangers of contaminated food? And two, should more testing be done after a woman has a miscarriage to determine why it happened?
So that's why we want to make sure we're getting good surveillance, we're getting good reporting to make sure that there aren't cases happening and deaths occurring that we don't know about.
And more importantly, prevention, making sure pregnant women don't eat foods that are high risk for listeria, like deli meats, soft cheeses made from unpasteurized milk, including brie, feta, queso blanco, and fresco.
I'm 14 weeks now.
Cranston mom Kim Sakuchi is pregnant with her second child. She's careful not to eat foods known to be risky during pregnancy, but admits it's not easy.
And definitely makes you, hesitant even eating out at restaurants, how safe their food handling is, and it's definitely something to think about.
According to the CDC, the recent listeria outbreak with cantaloupes has already killed 29 people. In addition, one pregnant woman who ate the contaminated cantaloupe and got sick miscarried. I'm Susan Hogan, Eyewitness News.
And you can learn much more about how you can stay safe right now on WPRI.com. You'll find vital information about food poisoning, including symptoms, common causes, a checklist of foods to avoid for pregnant women. It's all online right now on WPRI.com.